Optimum Wellness Centres, your best approach to feeling better.
Hello and good morning. My name is Dr. Shane Kraft. I am the founder and CEO of Optimum Wellness Centres. Optimum Wellness Centres is a group of multidisciplinary clinics, 19 in total, in southern Alberta, in Canada. My brief talk today is about what healthcare is and what healthcare is not, and why I believe we do not have a true healthcare system. I believe we're missing some components to that healthcare system. Very few of us would ever argue that we live in one of the greatest countries of the world. There's an abundance of fresh air, obviously, in water, quality food, universal healthcare for all, first world infrastructure. I mean, Canada is a wonderful place to live. Our government spends billions and billions of dollars annually on healthcare. In this province alone, this year, it's expected or anticipated that about 40% of the entire provincial budget will be dedicated towards healthcare costs. That equates to about $13 billion. As a nation, we spend we're almost at the top when it comes to per capita expenditure on healthcare. So one would expect that our fellow citizens would have great health and that our model would be one for the world to follow. The reality is harshly different. We know that we have tremendous wait lines in emergency rooms. We know that it's very difficult to get in for surgeries and to see specialists, and it can take years. We know that there's a shortage of general practitioners and that the health of our fellow citizens is at an all-time low. Now, how can this be when we live in a country of such great wealth, where we have the latest, greatest high-tech hospitals with dedicated array and highly trained specialists to treat illness and disease? Well, I would tell you, in my own opinion, that our healthcare system is fundamentally flawed, that we're really missing some basic things that need to happen if we are ever to achieve a proper healthcare system and true health of our citizens. I would also go out on a limb and say that the governments can continue to spend billions and billions of dollars a year on healthcare and see no appreciable increase in the health of our fellow citizens. We've been doing this for 30 years already, 40 years, spending tremendous amounts of money, and that expenditure continues to increase every year. A lot of leading economists say that it's unsustainable and it cannot continue this way. So what is missing in our healthcare system? Why are we not able to have a model that is efficient, a model that is admired around the world, and a model that works? And why is the health of our fellow citizens not improving and not at the top of the world? One major component that is missing is the whole idea of prevention. We really fund what we call sick care or crisis care in this country. When people are sick, they go to the hospital. When we look at what drives people to the hospital, it's largely diseases of lifestyle. These are chronic diseases, such things as diabetes type 2, heart disease, cancer, and obesity. They account for a tremendous number of the people that are visiting our emergency wards. So how do we help these people? It's very difficult to help these people because by the time these chronic diseases have established themselves in these people, they're very difficult to treat. They often don't respond well to expensive, high-tech treatment. They clog up the system. And a lot of these people live with these diseases for a lifetime once they've been established. And so it costs the healthcare system a tremendous amount of money to manage these people. What do we do? How do we change our healthcare system so that we can actually decrease costs, so that we can prevent the queuing of all these people lining up to get treatment and services? We need to go back to what's important, and that is prevention. We need to treat people when they are well, not just when they are sick and presenting to a hospital or an institution to be treated. How do we do that? Well, there are many ways to do this, but when we look at prevention, it's largely education. So there's all kinds of low-tech, low-cost educational treatments that'll help people when they're healthy. So what I'm talking about are things such as educating young people about the importance of diet, proper diet, educating young people about the importance of regular exercise, educating people about the importance of adequate rest and the care of one's physical and mental well-being. Those are all key things that we know help keep people healthy. Yet we do not do those with young people. We wait till people are sick. We wait till people present into a hospital, and then we tell them, after they already have a chronic disease or illness, that will probably be a lifetime patient in that clinic or in that hospital using healthcare dollars. It's time to recognize that our system is fundamentally flawed, that we need to devote more resources back to prevention, that we need to have more innovative government programs, incentives, financial and otherwise, to encourage people to learn and understand and take advantage of the prevention. Because prevention is key. Without prevention, you will never decrease your healthcare costs and improve the overall health of your citizens, or our citizens. Thanks for taking the time to listen.
Optimum Wellness Centres, your best approach to feeling better. Your comprehensive healthcare team. 855 call OWC.
One stop for all the care you need.
855 call OWC for one of our convenient locations. Optimum Wellness Centres, your best approach to feeling better.